Hello and welcome to Filibusters in Fine Print, where AMGA's public policy team gives you the insider view on healthcare regulations and legislation. Thanks so much for joining us for the latest from Washington, D.C.
Good morning and welcome to Filibusters in Fine Print, AMGA's public policy podcast with all the health policy news that's fit to print. I'm Chet Speed, your host, and here with our expert panelists as always. Why don't we start with our right today? Miss Latney?
That's me.
That is you.
That is me. I need to learn, put my fingers up, see what it is.
Because actually it's your left.
It is my left.
So there we go.
Yes. Lauren Likey, Director of Government Relations.
Alicia Sawyer, GR Assistant.
Jamie Miller, Ambassador of Goodwill.
Hi, Daryl Drevna, Senior Director of Regulatory Affairs.
Fantastic. So last time we were all here, we had this amazing cake brought by Miss Latney, which Miss Latney told me is going to be the question of the day. What is your favorite type of cake?
My favorite type of cake is, that's hard.
It's your question.
It's my question. I should have thought about that before I brought it up. Because I'm going to go with Italian cream cake. My grandmother used to make this cake for me for my birthday, and it was always so good. And I have not been able to match that since. So I'm on the desperate search to find it. My second one, because I can't just choose one, I think it's key lime cake. I love it so much. It's very southern. Yeah.
Fair enough. Alicia?
I like angel food cake with whipped cream and then like strawberries or raspberries, like some kind of berry on top.
You sound so dreamy.
I know. You want to be excused?
Yes, I'm going to go get this cake now.
Fair enough.
There's this cake called Brownie Explosion. It's made in Columbia, South Carolina. It's a circular cake, multiple layers of like a sponge chocolate cake with frosting, and then it has coming out of the top pieces and morsels of macadamia nut brownies. It's a lot.
Huh. I don't know if this is allowed, but I like pie.
Okay.
Doesn't Gaffigan have a whole thing like cake versus pie?
Cake versus pie. I do like cake. All desserts are welcome. I think German chocolate is my favorite. German chocolate cake.
Coconut?
It does. What's funny about that is I don't like coconut, but I love German chocolate cake. So
Really?
Go figure.
Interesting.
It's like, why do you think I
Add your
pick
cream
pie?
in too.
Yeah.
Okay, all right. Well, fair enough. Okay.
What's your favorite one?
Well, I hate to
Don't
jump.
say pie.
My favorite is Kentucky Derby pie because my family moved to Kentucky in the 1750s, and we do think that when we all moved to Louisville, we actually created Kentucky Derby pie.
Okay.
So we take ownership of that pie, and I make it, and it's got bourbon in it, and it's really good.
Okay.
But I also like cake.
And that K-Ro syrup. I love saying K-Ro. K-Ro syrup.
That came up so southern.
Yeah.
When you make it, you're like, ooh, that's a lot of stuff in there.
We have a very southern team.
He's
Knoxville.
Tennessee.
Yeah.
That's South Carolina,
Yeah.
Georgia. Lisa's Florida, which is
Kinda.
Not southern, but whatever.
I'm 2 hours from Georgia.
Well, we don't count that.
Like Bear? Come on.
My guy.
You're too polite.
VA. All right. Yeah, that's yeah, absolutely. So,
What's your favorite cake?
You're gonna hate me. I'm gonna say confetti.
Oh,
Okay. No, confetti is fine. Yeah, that's hilarious.
No, that's great.
Better than pie as a response.
Yes,
Please.
Confetti is magical.
Dreamy.
Dreamy, if you will.
very much so. All right, let's get to the topic at hand. So this is a Lauren Latney script, and I'm telling you, I am really scripted on this one because she thinks I go too far afield. So I'm gonna summarize stuff. We are gonna connect two federal debates that may not seem related at first, but they can significantly impact America's healthcare workforce, which is one of the biggest issues our members face every day. First off, the House Ways and Means Committee, which has jurisdiction over Medicare, recently held a hearing entitled Advancing the Next Generation of America's Healthcare Workforce, where the panel of lawmakers examined provider shortages, rural access gaps, And frankly, is Medicare's training programs aligned with workforce demand? I think there's an easy answer there, which is no. And at the same time, this is a really hot topic. The Department of Education is moving forward with a new federal student loan caps under the One Big Beautiful Bill Act. A key issue, how the department defines professional degree and the impact it may have on nurses and physician assistants and others. So a lot to, again, unpack today, and let's see what we have to say. So first and foremost, why is health workforce policy the new front and center? Alicia?
Yeah, I'm happy to break down some of the numbers for you. HRSA, the Health Resources and Services Administration, released a national workforce analysis estimating a shortage of approximately 141,126 full-time physicians by 2038. That's a pretty detailed number, but that's a huge number. Overall supply of providers is expected to grow a little bit modestly, but the demand for care will outpace the availability of physicians and providers of all types. 30 to 35 specialties are expected to face shortages, with the primary ones being primary care, OBGYNs, cardiologists, and anesthesiologists.
They aren't important.
Right? You want to have surgery, awake, or asleep.
Yeah, that's right. And my dad he had a heart issue, couldn't find a cardiologist for 6 months.
Oh my gosh.
Luckily, he's tough, but yes.
So the use of nurse practitioners and physician assistants will partially mitigate the increased use of providers. And that's something we'll touch on a little bit later, I think, in our discussion. But rural areas will be disproportionately affected by this healthcare workforce shortage. Geographic disparities show non-metro areas will experience greater shortages, with only 42% adequacy compared to 95% in metro areas. And all of these projections are based on current patterns of attrition, graduation, and labor participation, with alternative scenarios available for different assumptions. But it's clear that legislative intervention is needed. Something needs to happen.
And you're absolutely right. And Lisa, thanks for breaking down the issue. Lauren, clearly this is an issue of congressional concern. Can you let us know what happened at the panel and your other thoughts on this?
Yeah, thanks so much for breaking it down, Alicia. Especially because when you think about who trains providers and physicians, it's Medicare, and that's why there's such a direct need for legislative intervention on it. So last week, the House Ways and Means Committee Subcommittee on Health held a hearing, as Chet mentioned, on advancing the next generation of America's healthcare workforce. They had some of the major medical school and also like associations there who were testifying, and they really wanted to focus on rural physician shortages and then updating the graduate medical education policies. The central thing is GME, or graduate medical education, determines how many physicians are trained each year and where they train. And one of the things that kept being brought up in the hearing over and over again is like they're always concentrated in urban academic medical center areas. Now you have like the teaching hospitals, GME as well, but like for the most part, if you're moving into the area of a large city. If you would like for physicians to be elsewhere, I have always said that you need to provide them with a residency in a rural area and also a subscription to Tinder or what are the other ones? What's the one the women choose? Like all of those, they need to have that.
Bumble.
Yes, Bumble, so that people will stay in the area. You got to get married. You got to not leave.
I got to look up these new things. Okay.
You got to stay in the area.
No, you do not.
Thank you.
That's a Patreon episode soon enough.
My guy can't even look anymore.
Yeah, Patreon episode, Lauren and I explain dating apps to Chet.
Dating apps?
Yeah.
Oh.
Yeah.
Didn't even know.
Physically, he repels. He moves back.
Just put your phone down.
Put your phone down.
Yeah.
Don't Google.
If you see
Thank
them
you.
on Barkley's phone.
That's 5 words right there.
Wow.
That was
Yeah, that's
a chill into the
that's kind of
room.
that time. Yeah, that's okay.
So you're having these sort of disproportionate groups that are staying in the cities and not in rural areas. Also, rural hospitals often face financial and regulatory barriers when it comes to establishing training programs. Starting these training programs are very, very expensive. You need a lot of technical assistance to do that. You have some hospitals that are in some schools that are starting it themselves, but the build-up, it takes years before them to actually launch their residency programs. So there's been discussions about expanding Medicare supported residency positions and then modernizing allocation formulas better to match geographic need. There's also been talk about AI. I know this is something that Dr. Oz has talked about too, of like maybe in rural areas you might have some sort of chat box, you might have sort of AI telemedicine sort of fill in these gaps that are missing in these rural areas. But this is something that was really emphasized a lot with the witnesses, is that this is not accidental. These are federal policies, particularly through Medicare training programs. And so they brought up the need to pass the Resident Physician Shortage Reduction Act of 2025. This is something that we have endorsed, and it basically would expand these residency slots by 14,000 over 7 years, which is still not enough to fill out the gap of 141,000, but it is at least a start. But right now it's kind of hard for Congress to pay for anything that's large. These probably to expand these would probably cost in the billions, and we are sort of in a different mode now when it comes to spending. So I mean, this is something that's been brought up over and over again. I know Jamie will touch on this as well. But we are also learning that GME is just one side of the pipeline when it comes to training healthcare professionals. We're also facing a nursing and physician assistant shortage. And before we can even talk about them entering the healthcare workforce, they have to be able to afford to go to graduate school in the first place.
Lauren, that is an excellent segue, and thank you for the description of the hearing, important issues that we talked about. So, Daryl, why don't you let us know, what's up with AMGA's recent letter to the Department of Education and our advocacy around professional degrees for nurses and PAs.
Yeah, sure. Nurses, I think, is, to Lauren's point, this segues really nicely into what's going on in the Department of Ed. And I actually had to realize we still had a Department of Education because I thought it got doged.
That's right.
Out of existence by a lot.
Yeah.
So, under the One Big Beautiful Bill, OB3, Congress established new limits on graduate student borrowing. So, historically, graduate students could borrow up to the full cost of attendance through federal programs. And that legislation, that law changed that. So now graduate students are going to face annual and lifetime caps, roughly $20,000 a year or $100,000 in total. The rub here is students that are enrolled in designated quote-unquote professional degree programs qualify for higher caps, up to $50,000 annually, $200,000 in total. Fairly straightforward. Now, the issue here is, how is the Department of Education defining professional degree? Under the proposed rules, certain advanced healthcare programs may not qualify for that higher loan tier. So depending on the final language, programs as some nursing degrees, physician assistance programs, physical therapy, occupational therapy, social work, these are all programs you need a graduate degree of some form to be able to qualify and get your licensure to practice. That could fall under that cap, meaning those students won't be able to borrow up to the full amount. So if federal borrowing is capped below the full price of tuitions, students may need to rely on private loans. Those, typically have higher interest rates, fewer borrow protections, or they might not just, they might find something else to do. So, health systems, higher education institutions, state officials, AMGA, other associations have raised concerns that this narrower definition of what professional means could reduce or restrict access to, a key workforce pathway.
Okay. And so what do we tell Secretary McMahon and our...
Yeah, well, I guess, don't do this. Effectively, he got way more detailed, of course, and I'll walk you through what we said here. But at top of the line is you need to include advanced practice nursing degrees, physician assistants, any advanced practice provider that needs graduate level training should be considered professional under this regulatory, regime regime so they can qualify for those higher loans. And then we got into we pushed back on some of the Department of Education's reasoning and justification for what they're doing here. And so we're like, hey, before you move forward with something like this, you need to conduct and publish a workforce impact analysis. So how exactly is your proposal going to play out on the supply of these, advanced practice providers, physician assistants, particularly in primary care, anesthesia, rural health settings? And then, we told DOE, you need to take a look at your own funding decisions over the past several years. They effectively eliminated an office in the Department of Education that was funding postdoctoral programs that basically train the faculty that train these providers. So the pipeline of qualified teachers is drying up. So you need to take a look at that before you start changing around loan limits. And then, really take a look at how these graduate aggregate limits will operate within the broader lifetime of direct loan framework and, the access to, higher education and that sort of thing. So we pushed back pretty hard in our letter.
I thought it was strongly worded and well done. All right. So, Jamie, what happens next? And is there discussions on the Hill around, well, obviously GME, but also the professional degree issue that Daryl just talked about?
Yes, Congress is remain involved in the GME issue, getting more involved in the professional degree front. AMGA in general is advocating and continue to advocate for nurses and PAs in this professional degree front. We've been talking to a lot of members of Congress about that. Before we get in that, talk about the CARES Act. During the pandemic, they passed a law, and it actually authorized 1,000 new residency slots. I think Lauren mentioned a little bit about that, but also 1,000 is definitely not enough. I mean, the bill that we endorsed earlier was it 14,000, and that isn't enough. So there needs to be more of a communication between us and Congress about either raising those GME slot limits. I think the current state of Congress is they're talking about affordability, midterm elections, and I think it's important when it comes to affordability is also access. And Congress is going to be concerned, I think, when there's going to be less and less access for their patients, their beneficiaries to get access to nurses and PAs. When it comes to the actual Department of Education issue, there has been bipartisan support of this. Senator Roger Wicker from Mississippi and Merkley from Oregon, and there's about 150 members of Congress signed a letter to DOE trying to make changes to their DOE's policy. There's been a lot of communication between a lot of the Democrats on education and workforce committees and the help committee as well. So there's been a lot of communications about the impact of how all these policies will hurt the pipeline. And I think it's just very notable. We just need to keep on letting these staffers know. And I think Wicker is a good example of a Republican that cares about rural access. And so the rural approach, and I think we all mentioned that, being able to see someone outside the urban areas is going to be dramatically impacted by this DOE regulation.
All right, thank you. Well, I've really enjoyed this conversation, and this is sort of a new topic for us, at least sort of, and really appreciate all the work y'all done around this, and glad to see that Congress is also concerned about both physician shortages as well as professional degree issue, which is really important to both topics, really important to our members, and glad that we'll be advocating for this, for this year, and obviously in 27 when things really get heated up. Any final thoughts from anybody?
Yeah, it's interesting to see where this moves in Congress. I mean, you talk about affordability, we talk about workforce, we talk about housing. All those things are connected to making sure that our physicians and physician assistants and nurses are able to support the economy. These hospitals and things support these economies very strongly. And if we do not have the training and we do not have the education for it, then we're all for naught.
You're absolutely right about that. And we'll end on that. Thank you all for listening, and I hope everyone has a very good day.
Thanks for joining us for Filibusters in Fine Print. This podcast was brought to you by AMGA. For more information about AMGA's advocacy efforts, visit amga.org/advocacy.